Welcome everyone to the Chinese Medicine Podcast. We are streaming live all over the world from Perth, Western Australia today, as I usually do every week at the moment. So we're on a bit of a little bit of a roll. So a little bit earlier today because I got up earlier and I've managed to get started earlier today, and I've got to leave earlier, so that's why I've started earlier. And I hope that you're doing well. I hope you have had a good weekend, or perhaps it's even Sunday night for you and you are enjoying life. So yes, what's happening? We are going to talk about some questions we've had during the week, and I will answer people's questions live. That's what we do on this stream. And I hope that you are enjoying your life. I'm not sure what's happened there with the picture. Let's have a look. I've adjusted something and now it's made me small. Okay, good. All right, we've got a question here to start with, and I will just jump. I've got a bunch of questions here to do from the channel during this week, but also I will answer people's questions from the live chat as well. So feel free to put your questions in when you have them. All right, hopefully this audio is working well. It seems like it is on my end. Good. All right, so this is a bit of a this could be a long question. This could have been its own video, and I probably do have a video on this, but exactly to say, how do we fix spleen qi deficiency? This is such a common diagnosis that is given in Chinese medicine, and it implies that your digestion isn't working as good as it could be. That's kind of the gist of the idea, right? Like it. So there's a few strategies we can use. The main whether we can fix it or not, I do believe you can. So if a practitioner if a system of medicine doesn't believe or doesn't hold the idea that it can be fixed, that can be very disappointing for people as well, and it can be very hard to say. It's like, when you're given a diagnosis and it's a terminal diagnosis or something like that, right? Now in Chinese medicine we deal in these patterns of disharmony, so we don't tend to diagnose these conditions like we leave that up to Western medicine. Now we have that system as concurrently can work with Chinese medicine. But in the classical literature that Chinese medicine is based upon, there were conditions that were said, this is a bad prognosis. Like, the outcome of this is death. They would even say that. The outcome of this is, now, many scholars in the modern times interpret those things when they say the outcome of this is death, or no treatment can be given, or it cannot be cured. There's lines that talk like that. And some people think it just means that, like, they're not going to die immediately necessarily if they say the prognosis is death, because remember we're talking about an older text, and they never used this diagnosis of spleen qi deficiency, and nor was that ever referred to as saying like that kind of idea that you're going to die from that. But what I'm getting at is there are some things that once you have them, you kind of have to live in such a way that you're not going to cause that to exacerbate. And spleen qi deficiency is usually, not always, but usually one of these things where people are very sensitive to foods. And I think there are some kinds of diet and lifestyle type approaches where you can, and this is the conundrum for this stuff, because sometimes, most of the time, it's caused by stuff that we don't want to stop doing, right? And if that's the case and people go back to doing those things, then they often will end up with the detriment of that condition. So for instance, if you love sugary treats, you're never going to stop eating those things, and you find that really hard, then you probably are going to bombard your spleen, right? But what you need to do is line up your lifestyle and your diet in accordance with what's healthy, and just keep doing that. And you have to incorporate that in such a way that it's enjoyable for you in your life. And then the other thing you can try is like self acupressure or having acupuncture regularly. So you need to do this like once a week for weeks and weeks and weeks, maybe 6 to 12 weeks. For some, that's like 1.5 months to 3 months of treatment, right? That's like a solid block of treatment. Now, once people are feeling better, sometimes they stop the treatment and they don't get over that hump of like, or it could be feeling even better. Even with these self-treatment things like self-moxibustion, you have to remember to do it. You have to do it regularly. And that the point that's good for this would be stomach 36. So if you could only really do one point and you moxa or you press or you use this bird pecking method to stimulate or some kind of self-massage treatment on that point, and you're doing that regularly, I think that's enough to continuously, stimulate that you're doing it every day is what I mean by regularly. To keep on stimulating that spleen energy, providing you're not bombarding it with, detrimental stuff. So to really answer this question, Jacqueline, it's probably a difficult one to give a definitive answer no matter what in all circumstances, right? Because it really depends. Like a patient might come in and they have treatment, they have regular treatment, and then what was I going to say? They don't stop doing the lifestyle things, and they may feel better, but they wouldn't feel that it might not go away because they don't stop doing those lifestyle things. Now, you might have some patients that do stop doing the lifestyle things, but they can't afford to stay on the herbs or stay on the acupuncture treatments. And you shouldn't have to do acupuncture and herbs forever. Like that's not the purview of Chinese medicine. But once you've got something, it takes a lot longer to sort of treat it. So I would commit to the lifestyle stuff. All it's costing you is your time, and maybe there's a bit of money cost in there, but you have to buy food anyway. And sometimes it's just more a sacrifice cost, like, oh yeah, I'm not going to have ice cream. I'm not going to have these sweet things. I'm not going to have, you're going to, and transition that diet to what's healthy. And you keep doing that. And then you can often find that the herbs will work even better. Again, I want to say with this kind of thing with spleen qi deficiency, there's a massive difference between classical Chinese herbs and TCM herbs in terms of the warmth of substances that are used, and that warmth helps to generate that yang, which supports that spleen qi. So even though TCM's calling it spleen qi deficiency, in classical Chinese medicine, they would already kind of consider that a yang deficiency, So therefore, you need those warmer herbs. And that's why mox is great, because it's warm. It's a warm thing that you can do. So, those things. And then there's also things that support your function, which is things like sleep. So if that's awesome, if your sleep is really great, and stress, right? If you're super overweight, then losing some of that weight is going to take some of the pressure off of your body in general, which actually takes the pressure off your spleen and earth element. But that's easier said than done for some things. Like you might have injuries and it's hard to recover from those, or it's, so that prohibits you exercising, or, it's a multifaceted thing, right? So these are, all these things will help it, right? All these things that are healthy to do will help it. And you want to make sure that you are still enjoying your life, because that's what life's for. You've got to enjoy yourself, but find a way that these things that are healthy for you are enjoyable. That's what I try to recommend. So for the new people joining the channel today, joining the chats, please feel free to put your questions in. That's what today's for. This is a Q&A thing. So welcome. Share the stream if you have friends that are into Chinese medicine. They want to ask a question, and it's pretty niche. It's a pretty niche topic, isn't it? So I have a few questions to answer from people this week, and we'll just be going through some of those now. A little bit earlier on the channel today on the stream than I usually do this. Hopefully that's better for people, because it usually is on my end of the world and your end of the world. What else have we got? Okay, so these are just in no particular order. Let me grab this. Yeah. So, all right, here's a question about pulse diagnosis. This Tracy is asking this question. So Mrs. Tracy Gutchard says, is it hard to learn how to feel the pulse, and how long to learn to feel of pulse? Great question. So I think something is hard if you think it's going to be hard. That's one thing I would definitely say. And I know that sounds a bit mystical and like not answering you, but I think this is something that TCM students struggle with. Every student struggles with it. I've actually never met a TCM student that has not struggled with the pulse diagnosis unless they had a teacher that properly they were able to be properly guided, and they were also able to have sufficient training at feeling pulses. So this is part of the issue. So there are some teachers or authors, people in Chinese medicine, that would say you can learn the pulse by reading about it. And this is a Bob Flaw's philosophy. He says, stuff like, you can read the images of the pulse and cement those images in your mind, and then when you feel them, you will know what that is. Now, that can be helpful, but it really comes down to training with a teacher, and this is where so if you're a student of Chinese medicine, you're in school, then you need to seek out the opportunity to be able to be trained properly as best as you can by whatever teacher is a good teacher there at the school. Now, some of them will be great, and some of them will be, maybe do different styles, and maybe they don't rely on pulse as much. But if you have it in your mindset, that this is really hard or it's really confusing, it's going to be, and it will not probably stop being confusing and hard. So I remember when I was in TCM school, it was always felt like I don't know what I'm supposed to be feeling. It was always a pressure feeling, like when I would normally when practitioners see a patient, you have a discussion with them, you have a consultation, right? You talk, you do what in Chinese medicine 4 methods of diagnosis: talking or asking questions, and then you look at inspection is looking at the tongue, looking at the skin, looking at all the different things that you're observing about them, and you do all that stuff, and then you're sort of told, well, you do the pulse at the end. And I was taught originally in my TCM training by some teachers had mentioned this, well, the pulse is like confirming. And I remember at the college I was teaching at up till recently, that's what they, a lot of teachers there would say that. The pulse is confirming what you already now pretty much know, right? It should confirm that. Whereas the system I do now relies on pulse, and sometimes up to 80% of the diagnosis can be on the pulse. So it's not about confirming, it's about letting that lead the questioning, which is a completely different way of doing it to what you're taught in TCM school. Now, if you're just not just, I don't want to say that so meanly, but if you're a person that's, in China they call them a hobbyist, a TCM hobbyist. I still don't know what the right name is for people like that, because there's a lot of people like that on this channel. Everyone's there. I can see your question, Spiritual Parker. I will get to that in a minute, and thank you for joining the stream. I'll just finish this train of thought first, and then we'll get on to that one. If you're a keen learner and you are learning in an ad hoc way, there's going to have to come a point where you either decide, I'm going to find a teacher and learn from that teacher, and actually why am I learning this is going to be part of that. So I think it's very hard to learn pulse diagnosis if you don't have any patients to practice it on. One of the methods that you can use to practice it, no matter what system you're using, is if you feel the pulse and that pulse indicates something to you, like it indicates a diagnosis to you of any system, right? Because there's lots of different systems of Chinese medicine. So there's some that it will indicate an acupuncture indication to you, right? And you perform that treatment on the patient. You do that balancing treatment of some sort with the acupuncture, or you give them the herbs that's warranted. And that treatment definitely matches up to the diagnosis that matches that pulse. So let's say, irrelevant of whether you got the pulse wrong or right at this point, but let's say you said, oh, that's a wiry guan and on the left side, and that belongs to the liver position. So that means I'm going to needle liver 3 and, HER2, large intestine 4, the 4 gates. Let's say there was some sort of indication within your acupuncture system to do that. And then often with acupuncture, you'll feel the pulse before the treatment, and then you do the treatment, and then you feel it afterwards. So 5-element pulse diagnosis. Sorry, 5-element. The Worsley method of 5-element acupuncture follows this system. Right? And if you've had acupuncture yourself, you may have noticed that. You might lie on the table and your hands are sort of. I can't do this but you're lying down, and rather than being like sitting up is how we would do it like this for herbs, but for acupuncture you're lying down, so the hands are lying down. Anyway, so you do that and a change happens. So that teaches you, so long as that treatment you gave lined up with the pulse, somewhat that teaches you that your pulse diagnosis must have been correct. You were on the right path. Certainly if the treatment you give could have made them worse, if the pulse, if it was wrong, then hopefully that logic sort of makes sense. Then that's sort of teaching you, okay, you were on the wrong path. But if you don't have any patients to practice on, it can be a little bit meaningless. You also need to be guided by a teacher who will say, that's a slippery pulse. And you feel that and you go, oh, okay, that's what slippery is. And you might go, yeah, I can't really feel that, or I don't really notice that much. Some of them are really standing out, like really obvious. Oh yeah, okay, and the teacher will say something like, oh, that's a great example of a wiry pulse. Feel that wiry pulse. That's what I would usually say to my students, right? And you get that in your mind. You think, okay, yeah, there's a wiry pulse. And then, you come across a patient where you can't puzzle it out. You're like, I've never felt this pulse before. It's a rare pulse. Or you feel like, am I even in the right position? Like some people have a deviated artery. Their artery's on the side here. It's not actually here. And that's the worst one. That's the worst patients to have in a way, because you're sometimes feeling it and you think, am I in the right position? Like what's happening here like this? And then you're sort of trying to work that out. Now, if every patient you feel like that, something's wrong. It's you. It's not every patient has that deviated artery. So what I'm getting at is, even in an experienced practice, there'll be times where you don't get it. You're sort of struggling. And that's what practice is. That's a practice of medicine. That's why they call, medicine a practice of medicine. So yeah, hopefully that answers your question. I'll put a note on, the channel on your question. Hopefully you can jump into this stream and listen to that. Answer. Spiritual Parker. I want to answer your question, but then I just realised it's not exactly a question, but I will sort of. Do you have a question that you would like to ask? And there's quite a few more viewers here now. If people want to ask a question, please feel free to ask your question. What I do with these streams is I usually just catch up on questions that I've missed for a while, and then we get to the live ones. So I can just maybe talk about the difference between liver qi stagnation and spleen qi deficiency. It is a pretty common coexisting, concomitant, that's what they would say in Western medicine, thing, okay? But they are pretty different. So one is an excess pattern and the other one is a deficiency pattern. They both belong to the wood element. I'll put the little elements here, the 5 elements next to the thing. The spleen qi deficiency obviously belongs to the earth, and the liver qi stagnation belongs to the wood, but they can interact with each other, and it's common for people to have both. So when you do these patterns of disharmony in Chinese medicine school, you might be a hobbyist, you might be just a patient of a practitioner trying to understand it, or maybe a student, or someone that's had the treatment and you're trying to understand how to do some self-help things on yourself. So when we study these things in Chinese medicine school, there are certain symptoms that belong to one or the other. But because they commonly appear together, even some students I've taught, even final year students that are about to graduate, they struggle to differentiate between the two. So I'll tell you what the symptoms of each are, right? The biggest differentiator of qi stagnation and spleen qi deficiency is exercise. If you feel better from it versus if you feel tired, like how tired you feel. So both people could say, I feel really weak and tired, or they complain of feeling not enough energy. And it's not really the same as tiredness, like just not having enough energy. So we have to ask them a bit more questions about what that really means. So actually what it means is if you are purely deficient and there's no stuck qi there's no stagnant energy, you'll be verging towards like yang deficiency after the spleen qi deficiency. And you'll be the sort of tired that you won't want to be able to do much. If you do activity, you feel worse. So that's the worse you feel in that way, the more deficient you are and the less stagnant, stuck energy you have. Because you kind of need, it implies if you're in an excess that there's energy there to get stuck. So the main symptom is sleepiness in the day. That would be like really severe deficiency. And it's usually at that point, it's gone beyond just the earth. It's gone into the water element, really, where you're like that kidney deficiency kind of, in TCM, they'll call it kidney deficiency, right? Yang deficiency. In TCM, they may even say yin deficiency. So all that stuff's almost irrelevant at this point. It's so deficient you need to lie down in the day. So before you get to that so deficient you need to lie down in the day, a lot of people just feel not great from exercise. If they do a bit of exercise, they feel worse. Whereas with qi stagnation, just pure qi stagnation, a lot of people don't feel like doing the exercise, but when they do it, they feel great. They feel like, oh yes, I should have done that. I should have done that earlier. I'm feeling good. I'm feeling energized from it. And that's kind of part of stuck energy. If you move energy that's stuck, you feel better. Now, the other symptoms of qi stagnation is like hypochondrial pain or tightness. So around the bottom of your ribs, you feel tight. Now, sometimes it's just a matter of if you press there, you rub there, you feel better. That relieves the tightness. Like I just rubbed there then and I felt really good, right? Because it's actually going to move some of that stuck energy. And the seated position that we always are in, like I'm seated now, it's squashing your torso. It's not great for that movement, right? So standing, moving, stretching, those things, doing all that stuff usually moves the qi, right? Now, technically, liver qi stagnation has sighing, like that. You feel better with exercise. That hypochondrial tightness or pain. They also use this thing of like a plum stone throat for TCM with a qi stagnation. So you don't have to have that symptom, but it's common, like where you feel like there's something stuck here and it's difficult to swallow. And then there can also be all these flow-on effects to your menstrual cycle if you're a female, where you're going to have like PMS, pain with your cycle, particularly things in the week before the period happens. That's all like liver qi's domain to kind of move that qi. Right? Now, spleen qi deficiency is to do with your digestion. So technically, if you have sensitivities to food, like you say, oh, if I eat this, oh, I felt so sick, I felt sicky, that's nothing to do with the liver qi. Okay, it could be the liver qi, the wood invading the earth, but it's still the earth. The earth is too weak to repel that wood invading it. So that's a spleen qi deficiency, right? Anything to do with digestion, bloating, gassy, and then earth belongs to stomach belongs to the earth as well. So it can be reflux or belching or things like that. So technically they aren't spleen qi deficiency, but it's part of the earth. If the earth element's deficient, if the spleen of the earth is deficient, then the stomach function might not be working properly too. So there could be belching, and that's in TCM if you're trying to pass a test or something, they'd probably say, well, that's a stomach pattern, but you can have a spleen and stomach pattern at the same time. People are a bit more complicated than just one thing, so it's common that people will have both. So if I was rattling off all those symptoms, you think, well, I have both of those things, like the chi deficiency, some of that stuff, and some of that chi stagnation stuff. So welcome to being a human being. That's why I put the 5 elements here when I do these things now, because it's easier to sort of show you. So they have a cycle and they affect each other, and then they have a cross relationship you can't see drawn here. So wood controls earth controls water controls fire controls metal controls wood, like in that cycle. Yep. So that is that. Good question. All right. We'll get to the next one. Indigo Fire. Glad I caught you live. I'm glad you have too. Doing it a bit earlier today. That seems to be good. Where I live, we don't have daylight saving, so the time never changes for us. But at this time of the year, it changes. Around the world, people are getting, it's earlier for, like, yeah, anyway, being earlier for me is probably the same time for you in a way. All right, I'm just going to put this question on the screen. If other people have a question, please feel free to ask it. That's what we're here for. We're here to ask it. We're here for you to ask and to answer. Okay, so this is, I've just got to check something. All right, we'll just leave it. I was just thinking whether I close my back door or not. It's getting hotter in here. I'll open the door of the studio to let some air come in. And I'm like, how hot is it going to get today? Should I close it now? We are it's the end of, well, it should be autumn. Actually, technically, it's just it just happened to be the autumn equinox, I think over the weekend, which means it's the start of autumn, but it is still warm here, pretty warm, 35. Well, last week we had a few 35, 36 days. It's going to be 31 today, something like that. Anyway, let's do this question. Indigo Fire says, I'm glad I caught your live. Does the THC oil, cannabis oil, cause dampness like smoking does? I quit smoking a few weeks ago, but I'm using the oil and I don't know how I'm affecting damp heat. Yeah, good question. I don't know if I have a good answer for you. So good job quitting. It's hard to quit something. It's hard to quit a habit, even something like smoking. Just the mouth habit of doing that is hard. Now, it's definitely not going to affect your lungs as it was before, right? Smoking stuff, like there is a little bit of benefit to smoking in Chinese medicine. Like people say there is a benefit to it in terms of what is the benefit, or why do people keep smoking things? Because it warms the lungs. Now, unfortunately, the substance that you're smoking in is often damaging to you, as in, carcinogenic, could cause cancer, could be, like inhaling smoke isn't, it's an irritant to the lungs, right? But alongside that, inhaling that irritant, there's kind of a warmth that happens there and a dryness. Now, if you do vaping, that's one of the worst things for damp and in the lungs. It's going to cause a lot of detriment because you don't have the dry aspect. It's all moist. It's like inhaling moist vapors all the time. Really bad for you, vaping. So I just don't have enough. I haven't thought about this enough to think about what does THC do in terms of I don't know if it's going to cause you any dampness. anything that alters pain, and I'm not sure why you don't have to say why you're taking it, but anything that alters perception and pain affects your Shen. So is it any more damaging on your Shen to taking an aspirin or taking a Nurofen, an ibuprofen, a medicine that's, a Panadol, a acetaminophen, I think they call it in the US. Is it any more detrimental than that? Because those things are blocking pain as well, right? So if a substance has the potential to cause you to have euphoria, then that's even more damaging to the Shen, right? Euphoric feeling. So this is the same as something like with cannabis. I'm sure it's a dose-related thing as to whether you're going to have a euphoria from it. That would be considered an abuse, right? You have too much of something. So you have a small amount of something, it takes the edge off the pain. You have a larger amount of it and you can get into a higher state, right? You can get into a euphoric state. So some of these things are quicker acting on the Shen to make you high, and that's not great. So I'm not sure so much about just the THC oil as opposed to just marijuana, but definitely smoking marijuana in Chinese medicine is not a good thing. It's not a like, is it worse than alcohol? It just affects your body in a different way, right? It seems to damage the Shen much more than alcohol, whereas alcohol will tend to make people, like, their blood will get hotter, and they're as a result of that, they'll probably have a lot of, like, skin drying out, or their vessels drying out. I'm talking about long-term use, and these are things people do use to manage pain, right? Alcohol, cannabis, THC, this sort of stuff. So that's kind of how we think about it, right? There's you've got to manage between living life and managing pain and getting through your day and everything like that. And any substance you use to do that is going to probably have some side effect. It's going to have some detriment, right? Like if you take Nurofen, ibuprofen, like it's going to strip the lining really of your gut and damage you in that way. So, one Nurofen isn't going to do that, but you take these things all the time. So, yeah, sometimes this is a complicated thing, and it's just a matter of finding the thing that's going to be the least damaging, and that you also don't abuse it, right? That's probably going to be the detrimental thing. If there's a potential for something to be abused, and you have a nature that's an addictive nature, and you can't help yourself. So this happens with people that get addicted to opioid medicine, right? They start taking it for pain relief, and then, develop an addiction, and the pain, they don't really stop feeling the pain, but technically the pain is gone away, So I will answer any other questions that come up in a minute, the balance method, we'll talk about that one in a sec. I just need to do one thing quickly, so I'm going to put my little video on for a sec. So I just need to go and shut the back door and turn the AC on. Otherwise, this place I can feel it's going to heat up like a madness in here today. So just talk about yourselves for literally 30 seconds. Where's that little? I've got this little video here somewhere. Where the hell is it? There we go. All right. All right, I'm back. Sorry about that. It's terrible to leave the stream, but I had to. All right. So we're going to do this question about balance method. Yep. So Delilah Akim 8399 says, what do you think of the balance method? I really think it's a great method. I think it's a good system. There's lots of uses for it in terms of pain. I've also used it with people with acupressure. Taught it to people, taught it to patients to use in terms of self-treatment or self-manage, like managing pain, managing stuff. It's not a hard method to learn, and there are obviously different levels of how you can use it. So there's a book that Dr. Tan did called Acupuncture 1, 2, 3, and you can basically learn how to do it from reading that book. It's not hard. Now, people that go to the course, I've never done the Dr. Tan course, any Dr. Tan courses. I just started using it in my clinic, and there are levels of application of it that you can go to, for more difficult things, but using that method that he has in that book 1, 2, 3, which is basically like you find the sick channel and then you balance that channel. So that for people that don't know anything about what this is, the balance method, the idea comes from like a mirroring system, and that's not unique to Dr. Tan. He just kind of put together stuff that's already been in existence in Chinese medicine, already sort of put it together in a system that people could follow. And there are other microsystems or mirroring kind of systems where rather than thinking about, the whole arm, it's just the hand. So there's like little other points that are not, Tung acupuncture is one of those styles, right? Where you're not just using the 12 or the 14 regular channels, you're using, other points. So yeah, I think it's good. I've seen it work well for pain. I've seen it work really well in the clinic, and it's kind of what I use if I see a patient now. I would use the balance method. Not that that's all that I use. I'm not one of these people that's like, I only use that, but I use it a lot for patients now. If they have pain, I will use that, and either that or local points with Moxa. And in addition to the balance method, sometimes I use that as well. So I'm not one of these people who, like, a balance method is technically a distal method, which means you're not needling the local area. So there are some cases where I do needle that. It's not like I'm strictly can only do that. Oh, one of my paintings fell off the wall. It slid behind my cello, but the cello didn't fall, so that's fine. Anyway, what are we talking about here? Next one. I'm just looking for the questions. How do you eradicate candida in TCM, intestinal candida, right? So this is also probably fairly common sort of thing that people have. So there's a few ways that Chinese medicine could be used, right? It could be used on its own. In that case, you kind of need to do a few things together. One is have a diet that is not promoting the candida's growth. I have found now not every patient wants to do this, but a carnivore diet I think is suitable for that. There are variations of anti-candida type of diets that could be used, but you definitely need to eradicate all the dampness type of things in the diet, and sugar's the first one, and then carbs, which makes sense. Okay, now it's a keto diet if you're taking out all the sugar and all the carbs, so what's left, right? At the same time, we have to disrupt that that imbalance in the gut. That's like there's too much yin and not enough yang. That's an idea. And it's yin is a cold substance. There's too much cold there, so there's this growth of this bacteria that's allowed to kind of replicate there because there's not enough yang to sort of blast it out. There's not enough, fire, digestive fire. So it's about restoring that function. So I don't know about the methods with the TCM herbs. So I have not used them in the last 10 years, those sort of formulas, but I do know with classical formulas, there's a really good chance to affect conditions that are related to this sort of thing and increase the digestive fire. So there's that. But if you do those herbal formulas and people don't change their diet, it's likely that it will come back, later on, or they have to stay on the herbs. I've not treated many cases where I've just used acupuncture and not done herbs with it. But I would assume that if you do acupuncture regularly, it could have somewhat of a similar effect, especially if you reduce all the diet stuff down. So you'd probably want to use moxa, and you could use you still want to increase that earth's function. So that's what it's about. It's about making the earth strong as possible. Stomach 36, spleen 6 in sort of terms of self treatment points or acupuncture points that could be needled by a practitioner. But that on its own, is that enough? I don't think so. I think you need to eliminate the damp stuff from the diet, and your body needs that warmth. It needs lots of warmness. So you'd want to stop all the cold, dry, particularly the cold and raw. When TCM says it likes warm, cooked, and moist, it doesn't mean super moist, like as in like damp moisture, right? It just doesn't like you eating in your stomach. It doesn't like a lot of dry foods, right? Foods that are fresh will have way more moisture than any of those foods that have been dried out, and that's kind of the idea, right? So if you have fresh fruit versus dried fruits, the moisture's dried out of them, and then whatever's left is concentrated, and that concentration of those things is actually what's often bad for us, like concentrated sugars in dried fruits, right? If you're eating a lot of that stuff, and the same with any foods. So it basically means fresh foods. You want as much stuff that's fresh. Thanks for the super chat. That's lovely. What? $50 US? Holy shit, that's very generous of you. Thank you. You don't need to do that. That's very lovely. So I hope I've answered your question. And if you want to ask a follow-up question, that's totally fine. I'm just trying to think what other things you would kind of do in terms of like, it's very hard to do these sort of herbal formulas, without a practitioner. You can't get these classical Chinese herbal formulas without a practitioner in most places, because they use herbs that you need a process to get to. Otherwise, you're not going to feel good on the herbs, right? They are Chinese medicine isn't natural and safe like that many people promote it to be, right? It needs to be. That's why what a practitioner's for, is to make sure. And yeah, if you need a referral to a classical herbalist that can help you with this stuff, like that would be my recommendation, to do that alongside the diet stuff. If you can manage to do a carnivore diet, that may be enough by itself, right? It's a lot of people on carnivore diets find they get an anti-parasitic, anti-candida type of effect. So part of this also I would suggest that you do is, you can go and get tested and see whether it's there or not there, because there are tests that they can do to check to see this stuff. Oh, so that's the other option that I was going to say. So the other option is that you go down the Western medicine road and you use the antifungal medicine that they prescribe to you. which can be really rough on your body. But for some people, that's kind of where they're at. They've tried the natural way and it's just not working. And you use the Chinese medicine to support your body through the treatment. That's another option. So it's not that you only have to use Chinese medicine and that's it, right? There are some people that just like to be natural, and I totally get that. I'm one of those people. Like, I will suffer through something to avoid Western medicine if I can. But that whole process of that only works, that philosophy only really works if you get it straight away, right? Like, I had a colleague staying with me yesterday, and I said to her, I'll give you, like, do you want a bit of this formula? And rather than making it up, I said, oh, look, I've probably got a bit of it in my cupboard. And so I pulled out this box, and I've got this, like, so many formulas already made up. And like, I could see her eyes going, whoa, like, what's going on there? She wasn't being judgmental or anything like that. But I just said to her, oh, look, sometimes I make up stuff and I've only taken it once. And that was it. That's all I needed. And then I've put the rest in this little box of all these formulas. I've got a bit of everything, or I like to try a lot of stuff. And that's kind of me, right? I just try, try it, as in, I don't want to say that like willy-nilly. I try things that that just because I don't know what's working or anything. But I like if I make up a formula for a patient, I think it's good to try them. And this is gonna lead into the other question that we've got here. So this is not from the chats now, but someone on the channel has. We'll keep. If you want to ask any more questions about the candida, or we'll come back to that if I think about any more on it. Thank you so much for the super chat. You didn't need to do that, but it's very appreciated. I can buy myself another microphone. You always need more microphones. Where's this thing? I'm just going to find it here. So someone asked me a question, said, well, what oh man, I had all this stuff ready to go, and where is it? No, I don't want it as icons. I just want it as a list. Is it that one? $7.50s, 34. Okay, all right. They just said, what herbs do I take myself, right? And that sort of led me onto that, like your question sort of led me onto that question, but it takes me ages to get the questions onto the it takes me ages to get the questions onto the screen. Because I am slow. So this person said, do I take anything yourself, right? So I was saying, like, last night I had all this box of herbs and I got them out for my friend. I was like, I've probably already got something made up for you. We don't have to make it up. So if you get onto things straight away, now you can't do this unless you've got a herbalist on call or you go to them immediately when something's wrong. And that's actually how Chinese medicine is supposed to work. A little change, you can treat it straight away, and it's not really a disease at that point. It's just like a little symptom. A little symptom has happened, and then you can get onto it. Now, it doesn't mean that nothing ever happens to me, right? Or stuff never happens. You can't guarantee that nothing's going to ever happen to you, but you generally don't need to be on those herbs for a long time if you're sort of taking it, okay, a little bit of this, and then because you've gotten it on the day one that it first happened, or the day two that it first happened. Now, there are stuff that creeps up on you gradually that you don't notice. Like, even for me, that happens, like, or you just sort of put up with something thinking, oh, that's normal. And then it doesn't go away. And then you're like, oh, that's not really normal, but you've missed a bit of an opportunity to potentially treat it when it was just a little thing. Now, I get that. Patients aren't going to come in, when they're just like, oh, my fingers doesn't do this thing. Now, some people do, but in general, we're busy. It's expensive to see practitioners all the time for things. But how Chinese medicine's, ultimately meant to be practiced. If you go to a herbalist every week, they're going to feel your pulse and they're going to feel all these changes, and you take the herbs that they're prescribing you to take. It's very preventative at that point. It's not, as in they're going to notice. Like I had a patient the other day that I was like, "Are you sure you're not getting a cold or a flu?" And they were like, "Yeah, I feel fine. I feel okay." I was like, "Are you sure? Like, do you have this? Do you have that?" No. I was like, "Do you feel a bit colder than normal?" "Oh yeah, a little bit colder than normal." I was like, "Okay, good." Right. Not good as in they're sick. But I'd felt something in their pulse, and it's been many, many times that I've felt that, and I've been like, "Oh yeah, they've said they're not sick." And then the next day they ring up like, "You know what? I did get sick the next day." So I just gave them the herbs then. Like, you trust yourself the more you've been practicing with this stuff. And, when you think about using these things in a preventative way, if you're wrong, what's the worst that can happen, versus if you're right, what have you prevented? And sometimes you don't know what you've prevented because it never happens. That's the mystical thing of Chinese medicine. So, it can be a little bit weird. So I do take some stuff myself. I do take if I get sick with a cold or a flu, and I don't have the herbs on me. Like if I feel a bit of a sore throat and I don't have my herbs, I'll be like, where are my herbs? So I never travel without those herbs, because if you feel I know that they work straight away when you feel like, you especially when you're traveling, you go, you're touching all different things. You're on an aeroplane with lots of other people's germs and all that sort of stuff. And then I just take other herbs, like tonifying herbs sometimes. There's certain formulas that we use around the winter and the summer solstices. Like they're just like preventative, or treating helping you transition the season, that kind of thing. All right, we've got a few more questions here. That's good. Missy Nelson says, "I was told I was a herbalist in a past life." Sounds interesting. National Public Adjusting 180 says, "I found that using ozone rectal infusions actually draws the candida out of your body. Ozone gas has more specifically at home with my ozone generator. Highly recommend it." Well, that's something interesting. And it follows the idea of making. There's a few things with candida. Oops, my hair's gone crazy. Oh, these headbands are like lovely, but they press your head too hard sometimes. I can only wear it for a certain amount of time. So anything like it's about making the body less inhospitable to that environment. Oxygen is yang. It's qi. Well, it's qi, right? And it's on the side of yang. Qi and yang, blood and yin, if we differentiate them like that. So that is sounds like a. I can see how that might work, right? Although there's nothing in Chinese medicine about putting ozone up your rear end, and I don't really know how that. I'm only laughing because I'm just imagining the treatment, and I'm not sure if that would put gas up into you. Like, would it make you gassy up there? Would it put air up there that shouldn't be? I'm not sure. I'd have to look into the treatment. Yep. So I don't know about the air. I'm just thinking about with the air, does it put air up in there or not? Day 2 of fasting. Missy Nelson says, "I'm on day 2 of fasting to help with my dampness." Good. So in Chinese medicine there is some use of fasting, but in general, who's dinging my doorbell? Hang on a sec. Oh, I'm just going to check if that's a parcel. Hang on. Sorry, it's one of those days today. I shouldn't have got out the front to the clinic. Sorry, that's terrible. I've got no music to pause for you. It's just it was just a random person with a handful of medication wanting to ask a question. But I just said you'll have to make an appointment, unfortunately. Yes, so I just thought it might be my herbs parcel, man. Or something like that we need to get it. Right, so what were we up to? The fasting. Right, so fasting, yeah. So in Chinese medicine, fasting is something that can be used, but it's not that commonly recommended. So what does fasting do? It gives the earth element a break. It empties it out. So when there's no food in there, it can do its job. It can do its other stuff. It can do its job of digesting things. And that would be the benefit of fasting, right? Now, you can't live on fasting because your body needs that nourishment. But this sort of thing of like intermittent fasting, as in, I don't mean you can't live on fasting. I mean, as in you can't live on fasting forever. Like you can't just never have any more food, right? That's not going to help you. It's going to be great. But some people's intermittent fasting is actually more closer to what we should be doing. And I've got several texts that are like centenarians in Chinese medicine and longevity, like stories of people with longevity. And one of the common things in that, as people get older, and some of these people are like 108 years old and stuff, and they ask them what they eat and stuff, and often they have one meal a day. And this is, in the 50s, in the 40s, like these are times before the OMAD was a thing and a trend, right? Think about modern technologies for food. That's very newish. It gives us access, like we have way too much access to food for our own good now. And that's one of the issues, right? You've got a fridge and you've got Uber Eats and you've got Macca's, and, in Australia we call McDonald's Macca's. You've got on-demand sort of food. Now, before you had refrigeration, shops couldn't have had all that stuff going all the time either. And before you had fast food, like whenever the first fast food was, KFC or McDonald's or whatever it was, you just didn't have access to foods like cooked foods and processed, and even like the technologies we have to preserve things. You did have preserved stuff, like people had a food called portable soup. They used to boil up this sort of broth into a sort of a leathery puck, and they would then mix that with water and make a soup out of it. So pemmican and these kinds of foods that are like, like what we would now say like things like biltong or, dried meats, and you've got dried fruits and, preserved jams and preserved foods like that, but not as much on demand, right? So I think that's why fasting's become so popular in a way, because it's kind of just this flip side of having too much. It's like now people have got to have you've got to force to have less because it's just so available to have stuff, right? You've got a fridge, you've got a freezer, you can pretty much eat whatever you want at any time. You don't have to be reliant on the seasons, when something's in season. Even with fruits, like you think about fruits, like my neighbour has a fig tree at the back, and it hangs out the back of the clinic, and there's only figs on there for 3 or 4 weeks of the year, right? They start to come and then they're ready, and then they're ready and they're nice and juicy and they're dropping for 3 weeks, and then they're gone. They're gone. That's it. There ain't no more figs. And I picked some and I put some in the fridge because they hang over the fence and they just drop on the ground if you don't pick them. So no, I'm not taking them from someone. Just taking them from the birds. And it's just interesting to see that in nature, isn't it? Right? Now, if you've got a fruit tree, you can observe that and you can say, oh, the fruit's in season now and the fruit's not in season now. But we're so out of touch with these things. We don't know what's in season, when's things in season. So what you would do is you would pick all that stuff and you would eat some of it fresh, and then you would preserve some of it. But you wouldn't be stuffing your face with figs every day for the whole year. Like, you just wouldn't be doing that. So I've gone off on a tangent now, but that's part of, I think, why fasting has had such a resurgence, because like the last 50, 60 years, we've had, too much stuff, too many things on demand. What's the best homemade drink to get rid of dampness? I don't know. Homemade drink. Let's have a think about that. I can think of something. I've got an idea. Put this on here. I don't know if I have the recipe right here, but I'll give you the idea. And what it is actually the old-fashioned barley water. Barley water. So barley is a food that flushes damp. It drains damp. It's not as detrimental on your body as beans, and nor would you probably want to make a drink out of beans, although like Chinese culture will make drinks out of red bean, but they normally put a lot of sugar in those things. So you've got to be really careful when you buy over-the-counter Chinese medicine-y based foods that are drinks, like chrysanthemum tea in a can or sachets of this chrysanthemum tea, and it says clear heat tea, but then you look on the thing and it's like so much sugar. So much sugar. So barley, like a homemade barley water, okay, the old-fashioned barley water, and not too much sugar or any sugar in it. It's bland. It's a bland drink. I think you make it by boiling barley and letting it cool and draining the barley out of it, and you drink that. Now, when you are flushing something in your body, then what will happen is you'll urinate a lot more. You'll be urinating frequently. Yep. And you don't want to be doing that all the time, but that's kind of the idea. Now, I want to preface this sort of thing about saying flushing the dampness. This is for acute dampness. So if you have chronic dampness, then you probably have concomitant spleen qi deficiency. And that's not a matter of just drinking a tea to get rid of the dampness. You have to increase the function of the earth to make it stronger so that it gets rid of the damp. Rather than saying we're going to flush the damp out, okay? Why is the damp still lingering there? So an acute dampness would be a urinary tract infection that's just happened. Like it's literally just, and you've got cloudy urine and it's a bit of a smell, but it's not really that, it might be a bit warm, but it's not really that hot or anything. It's just a bit warm and it's cloudy and there might be like a bit of a funky odor there. And you didn't have it yesterday, but now you have it today. That's acute dampness type of a thing. So if you have chronic damp, be careful about, you don't want to necessarily flush things, because when you flush that, you flush everything. Yep, you're draining. So I think I've got a video on the channels that was recent about something like that, talking about be careful about, if you've got spleen qi deficiency. If you've had damp for a long time, you basically probably do have spleen qi deficiency. Because if the spleen qi was strong enough, you wouldn't get the damp. That's the idea, right? You would repel the damp. I almost put a plant here today. I don't have one now. But the idea is with a pot plant, right? You have certain things that will keep that plant healthy. So you've got soil, you've got water, and you've got sun. So the soil is the earth, right? That's representing the earth element. And for the plant to grow, right? That's us. That's our flourishing. You don't just have the soil, okay? And you don't also just have the water, and you don't also just have the sun, because either of those things by itself will not have an environment for it to thrive. So if you've overwatered that plant, that's dampness. If you've watered that plant and there's no drainage for the water to go, that causes damp. I've had lots of little pot plants that I've killed like that because you overwater them and you think, oh, that plant might need a bit of water. Oh, that plant might need a bit of water, so keep watering it. And it doesn't need more water. It dies, right? Because it's waterlogged. The water can't get out, it's rotting the roots, and that's dampness. If you left it inside in a cold environment and there wasn't any sun, then it will go moldy. You'll see little bits of mold, and that's the idea of dampness. So basically, we want to put that little pot plant into a dry place, a hot dry place, right? Not scorching it from the sun, but you need some kind of that sun coming down on it will dry some of the damp. And that's the idea in Chinese medicine. You can drain the damp. You can poke holes in the pot and let the water drain out, or you can dry the damp. And sometimes you have to do both of those things. So that's where a herbalist will decide like what method we're going to use. And when we dry the damp, we often are using like fire, as in warm herbs. That the idea of fire, which is herbs that are warm and they dry things. So one of the best herbs that does that, the best example of a herb that does that, is dried ginger. So gunjiang, Ganjiang, gunjiang, right? So that dried dampness, now we don't usually use that just by itself. One herb by itself is never a formula. It's used like a common formula that gives a good example. That would be a thing called Li Zhong Wan. Again, I'm not suggesting you self-prescribe these things. This is where you need to see a practitioner, because if you don't need this, you probably just give yourself constipation. You might not feel good, and it might not be right for you. But that kind of a formula is the design of that is to dry up the damp, right? To dry that, to strengthen the earth by putting some dryness, like sponging up, soaking up the extra water. Right, Baiju is one of the herbs in that formula, and in that way it strengthens the earth. So sort of to answer this question, that's a follow-on question here. We've got a few about this idea, increasing the earth. How do you do that? Yeah, so exactly like what I just said, that kind of making the earth strong by giving it its what it needs to flourish. So it does need some water, but it needs drainage for that water. It does need sunshine, but it doesn't need to be out in the sun all the time, right? So even just your body, like it needs the yang from the sun. We need that. You need to get out in the sunshine every so often. You can't stay inside all day, right? In that cold and sort of damp environment. So that is, that's that. That's answering that question. Sorry, I'm just seeing where we've got up to with the questions. What's the best homemade drink? We've done that. I recently learned about dampness. Should I use foot patches and spleen tea? And then someone asked another question here, something about spleen tea. I can't see it anymore. Maybe it's lost on there. A patient asked me about spleen tea the other day, so I have no idea what this spleen tea is. So you're going to have to, maybe someone put a link in the thing of this spleen tea. I think someone's made this up, as in, I mean, everything's made up in the world, isn't it? Like, that's a dumb thing. But I feel like it's an influencer thing or something like that. Here we go. I've just Googled it and it's come up in AI. It's all over. I think these people are just making up little blends of it, maybe. Ginger, fu ling and chen pea, red dates and goji berries and dangshan and huangqi, right? It's like a lot of things mixed in together there. So Ginger, I've already talked about what that does. And the tangerine peel, the fooling. So rice. Rice, I think, for spleen tea. I don't think they put rice in it. Do they put rice? No. I'm just Googling this. So, oh yeah, ran. So I think these are just random herbs mixing together that people have made up. It's not like one specific tea, is it? Right? So, I mean, I can talk about what those different herbs do, and we can kind of work that out. So, and like often I will suggest people to use these things for dampness by itself, right? So, chen pea or mandarin or it's actually tangerine, but you can use mandarin peel. When you eat a mandarin or a tangerine, you save the peel and you let it dry. Now, the chen pea is actually like supposed to be aged, and it tastes amazing. It's got a really fragrant sort of smell. It's great for making a tea out of. So it has a slightly sweet flavor, but it's mostly like a sour, maybe slightly bitter kind of flavor. And bitter is a flavor that sort of tends to dry up the damp, right? It tends to help with the damp like that. The aromatic nature of anything that you drink like that helps promote the movement of qi, right? So pungent things, and they've got that aromatic sort of moving kind of quality, can be really good for the wood element, and that helps stagnation. So if you're trying to get things moving, like your digestion moving, you sometimes want to improve, where is it over here, the ability of the wood to control the earth, helping that to function. So I can see how that would help. And then this Google thing is saying you've got fuling, which is like a herb that it drains damp, and it it has a tea. I put that in some of my teas. Like I have herbal teas that I make and sell those teas. It's like a chalky sort of taste, like these teas you want, if you're making a herbal tea, it's got to have a good taste to it. Otherwise you're not going to sip on it all day long. You're not going to really enjoy the taste of it. And then it's saying red dates and goji berries, right? So these things you wouldn't really have if you've got damp, but they will strengthen the earth in a way. So how do they do that? They're not really strengthening the earth. They're actually just helping the fire element. They're helping calm you. They make you feel good. And if someone's like malnourished, then those sort of sweet flavors can build the substance. But if you're damp and you're overweight, you probably don't want a lot. And it depends on how many things are in this formula, like, the amount, the grams of each thing. And then the Dangshen and the Huangqi. So, I mean, I'm just reading this off of, this is the AI overview from Google that's come up when I said spleen tea. Dangshen is a type of ginseng, and ginseng tonifies and it builds the fluids in the earth. It builds the resilience, the nourishment of the earth. And Huangqi is another herb that's also a tonifying type of herb. So it's sometimes used in TCM to prevent colds and flus from like strengthening your immune system. Goji berry is one of the herbs that's, because a lot of people are mentioning goji berry in the chats thing. It's much more of a food than a herb. It is a herb, okay, but it's it's a blood. I mean, it's a blood tonic herb food. It's obviously a delicious tasting thing. It can be a little bit of a sour taste. You can put it in. You can put it in the. You can. I mean, I used to put it in my Rocky Road, like make a goji berry Rocky Road. Like you can put it in different things. And but it's not as strong as all these things aren't as strong as going to see a herbalist and getting a formula that's made for you, right? It's just not going to be as strong as that. All right. So that is hibiscus tea. Someone's mentioned that. What do you think about hibiscus tea? It's a really delicious tea, actually. I recently made a tea in my my business, because I have a herbal tea business as part of what I do. And I put a hibiscus in it, and it was like, oh, the taste is so good. Like it's really zesty, tasting, and it's got a sort of a sour, a sweet, but also like a sour kind of notes that comes out of it, and it makes a really good iced tea. It's known for lowering blood pressure, and it would probably have some affinity to blood because it's red, like if we follow the doctrine of signature. So hibiscus isn't really a Chinese medicine thing. I don't think hibiscus is a Chinese medicine thing. Let me have a look. Fu Rong. No, it's not a Chinese herb. I've never heard of it as a Chinese herb. I mean, it's probably used in Chinese culture as a tea, but it's not a common Chinese herbal medicine. Yeah, super aromatic, like it's really nice. And it has been used to sort of I think one of its properties is to lower blood pressure. All right, what have we got here? We're probably going to finish soon, so I have to go to an appointment. If there's any other questions, this will be the last chance to ask those. Can a person use essential oils for substitution for herbs? No. The answer is no. Some things most of the time I have to give you a long-winded answer, but no. I do have a book. I don't have it on my desk. I've had it on my desk all week, but I don't have it here. And it is about the use of essential oils in Chinese medicine. So can we think about essential oils in a Chinese medicine way? Yes, of course we can. Okay. We can think about what oils have an affinity for the different elements, and that would be the best way to think about them. But there's no substitute even for a herb properly. So if you are a real boy, if you're a real Chinese herbalist, you can't substitute. Like if I run out of cinnamon, I can't substitute anything else for that cinnamon. I'm really screwed if I run out of that cinnamon. If I run out of red dates, there's not really something you can Now, when I did TCM, before I did classical Chinese medicine, they were constantly substituting things in there. And it was just seemed a bit hit and miss. Oh, you've run out of this, use this. You've run out of Fu Shen, just use some He Huan Pi. They both calm the Shen. Right, this idea. Well, they're both in the same category, so they must be similar. But if you really understand what the herbs are doing, you can't even substitute those herbs in that formula. You just can't. Like it's not impossible and it's not implausible, but it's hard. It's hard, right? And then to think, okay, now if you really understand what a formula is supposed to be doing and you cannot get that herbal formula, there are some cases where we might try to use foods. A good example of that would be get a cold or a flu. Day 1, you're supposed to take Guijiatang. You don't have any Guijiatang, and a day's going to go past. What's that Guijiatang supposed to be doing? It's essentially heating you up a little bit so you can open your pores and have a bit of a sweat. And then if you had that sweat, you would get better. The cold, you've got shivers and cold. And yeah, okay, it's not just Guijiatang, could be Ma Huang Tang, depends on what's the presentation of the person. But the essential idea is the day 1 of being sick, you're cold and shivery, everything's closed, you want to open that up. And if you sweat, If anyone's ever been sick like that, you kind of know. You're like, oh man, if I could just sweat, I'll feel so much. Like, or you had you went to bed, and even if you didn't take the herbs, sometimes that happens naturally on its own because it is supposed to happen by itself. And you went to bed and you had a bit of a sweat and you wake up and you're, oh yeah, I thought I was going to get sick, go down with something, but now I feel good, feel so much better. And you're like, yeah, I had a bit of a sweat in the night, or, that idea. Anyway, so we can substitute the idea of what those herbs are supposed to be doing with foods. The best way to do that would be like have a nice hot curry with some rice, and it's kind of doing the same thing. It's not exactly doing the same thing, but it's kind of doing the same thing. And that could kind of work on that, in that situation, right? But to go, all right, the herbal formula is using these 5 herbs, we're going to put these drops of essential oils instead. There's no precedent for that in Chinese medicine. Also, ingesting essential oils, I would never recommend that. It's not my purview. I know some practitioners do it, but that's not my practice, and that's not the place of Chinese medicine. Now, I don't think they used essential oils as medicinal substances in Chinese herbal medicine. They used things that we make essential oils out of, like frankincense and myrrh, but they didn't process them into an essential oil before using them. They just used them and boiled them or ground them and put them into the mixture, put them into the formula. I'd have to talk to other scholars to find out definitively if essential oils has never been used, but it's not a part of Chinese herbal medicine as we use it today. Definitely not. It might be something that modern practitioners kind of use. Now, what this book that's really good if you're interested in this kind of thing. The book is by Gabrielle Mojay, Mojay, and it's got such a weird name. That's why it's I'll see if I can quickly find it here. I'm pretty sure it's Mojay. Yeah. It's called Aromatherapy for Healing the Spirit. Gabrielle Mojay, Mojay. And it goes through each essential oil in terms of, not every single oil in the world, but lots of them, in terms of what their properties are in Chinese medicine. So do they, have an affinity for different elements? And you can think about these things as in scents have notes about them. Is a top note, a middle note, a low note that kind of indicates partly how they work, what they do. So those things can be used to work out. Like, citrus notes, for instance, usually top notes, they tend to have a more affinity for the wood element. They kind of move energy. They help with things like creativity and a lot of the things that when we think about essential oils like that, it's more on the mental, emotional stuff, right? But yeah, no, we can't. To answer that question, sorry, Missy, we can't substitute essential oils for herbs, right? All right, any other questions before we kind of close off for the day? I've got to take this headband off. It's reached the peak of its time. Can't be used anymore. It's hurting my head. Cool. All right. Well, thanks everyone for the stream today. This was a good stream. Lots of people on there. I will endeavour to do earlier. Obviously, that's a better time for people. It just means I have to get up earlier, get going earlier. So I hope people have a good week ahead. And there will not be a stream when it's Easter, but that's not next week. There will be a stream, and then on Easter Monday we'll have a little break. And I also have some really exciting stuff coming up on the channel. When I was in Brisbane last month, it actually seems like longer than that, but it's only last month. Whatever it was, 6 weeks ago from now, I did some interviews with some people there, some practitioners, some in-person live interviews. And I've been so busy with my clinic. I've got a lot going on with my clinic. I have to move from here, which is a massive bummer. So the process of looking has begun in a major way. So anyway, I've just been so busy with all that sort of stuff, and I haven't had time to edit them. But on the weekend, I edited one of the episodes. That's with a guy called Michael Brown. He's a scholar in Chinese medicine. He has translated maybe 6-7 books. He's just like a dynamite of translating. He's done so many now. And I'm going to put that episode up this week. Now, what we're going to call it is something like the crazy things you won't believe in Chinese medicine history. So he's got some amazing little stories that he's found from his research about cases that have been, the way that herbs were used. I don't want to do the spoiler for it because some of the things are really like crazy, and you're just like, oh, so if you're a student of Chinese medicine, it'll be really, really interesting for you as well. But yeah, if you're just an enthusiast, then it's going to be good for you. Another question there. What about not showering after 7 p.m. or even getting water on hands? I don't think that matters. I'm not sure where you've heard that from. I'm not trying to debunk someone. Like if there's some evidence to support why, or they've got some theory as to why to do that, I have no idea. I've never heard of that. It sounds not great. It doesn't sound, I don't know. I've never heard of that, not getting water on your hands after 7 p.m. I'll have to look into it more, why that might be said. There are some things about not showering or not bathing, I should say, because they didn't have showers, but not bathing at certain times. And often that is because of how people had to bathe in those times, and it was very cold. So if it's in winter and you bathe on the balcony of your house or outside, you're gonna be freezing. A lady on YouTube that claims that, yeah. Well, I'm a lady on YouTube, and there's a lot of ladies on YouTube. There's a lot of people on, so I can't say much because that's what I'm saying. I'm a lady on YouTube as well, but you could get on YouTube and say whatever you want to. A lot of people can say what they want on YouTube, so. That's why I'm saying I don't want to say bad about it because I don't know about it, but there's got to be some reason there. But there are some of these things that have come from a good reason, but that reason probably isn't that much in existence now. Okay, so bathing, for instance, if you go outside to bathe, you have to take your clothes off. Now you're exposed to the wind and the cold. And when you're putting water on yourself or your hot water, you're actually opening your pores, and then the wind and the cold can come in even more. So one of the things that's not great when you're showering and it's winter is and this is why we don't really see this that often because people have so many good modern conveniences. I remember when I was a little kid and we just didn't have in Australia, it's not that cold, okay? Where I live in Perth, it's not that cold, but it would get cold in winter enough for you to feel cold. And I remember getting out of the shower and the treat would be not out of the shower, out of the bath, because you'd be sitting in the bath for ages, right? As a kid, right? You'd be in there. And my mum used to use it as a way to keep us entertained. It's we had a thing called tea in the bath, and she'd give us our food on little plastic plates that would float around the bath. We used to think it was awesome, right? It was like a treat thing. But then when I got older, I realised that it was mum's way of getting other things done in the house while we were having our tea in the bath. Anyway, and she would bring us food that would float around the bath, like cheese and, it was on a plate, but inevitably the sultanas would fall off the plate and, little sandwiches and it was a fun thing. Anyway, and then you get out of the bath and you'd be freezing because you've been in there for so long and the water's gone lukewarm, and that's not good for you either. That's really bad in Chinese medicine, sit around in lukewarm water. And then we would get a towel around us and sit around a little blow heater and sort of warm ourselves up with this little blow heater. And that would be the treat if we were allowed to use that little blow heater, right, to sit by the heater and get warm. These days you come out of people have a heated towel rack. They've got a heated thing. It's all steamy and hot in there. you're not at the mercy of the elements. Whereas in these old times where they talk about don't shower because of, like for instance, the month of confinement for a woman after you've had a baby, part of that is not washing your hair, not showering. And part of that is because how you would shower would expose you. There was no way, there was no way to keep the house warm. There wasn't central heating. There wasn't like fireplaces that would keep it wouldn't have your bathroom certainly wouldn't be warm. You might have a fireplace in the lounge room, but you're not showering and bathing in the lounge room. So you have to go into a cold place. You take all your clothes off. Now you're exposed and you've got water coming on you. Some of this stuff wouldn't be, you'd be bathing like this with a cup over you and, with a little scoopy thing. And, you're cold on this bit and then you're warm on this bit and that kind of thing. Like, or you're outside. Often these bathing things were outside. So some of these things have come into the medicine through a good reason from the past, but that reason might not necessarily be appropriate now. So I'm not sure if that's the reason why she's saying that, not showering after 7 p.m. Some people follow the Chinese medicine clock, religiously, and they're like, oh, that's the kidney time. Never shower then. There's conjecture in Chinese medicine as to whether that clock's correct or not. Like, it's not the organ clock I'm talking about. Every organ has its time. That's not actually the case for all systems of Chinese medicine. They have a different clock and they say that the organ times are different to what the standard TCM clock times are. But anyway, that's another thing. Right, another quick question here. Does sitting in the sun dry up the dampness from the body? I don't know if it dries up the damp, but it certainly would. It certainly helps your yang. There's this idea of recharging your yang from the sun. Now, you don't want to burn yourself. You don't want to get sunburn. You don't want to expose yourself to skin cancer unnecessarily. But I think it's part of it. Like, you need yang. The best times to be exposed to the sun is early in the morning and late in the evening as the sun's coming up and the sun's going down. Particularly the early morning sun is the better kind of sun. It's less harsh on the body. It also releases your cortisol and helps you kind of get into the day, right? So that's a lot of practices, a lot of yoga practices stuff greet the sun, like you get up with the sun. Again, we've lost these kinds of ideas because we have light artificially. We don't have to do everything with the sun because we can turn a light on and be up at 11 o'clock at night, right? So I don't know if it dries up the damp, but it is, if we follow that analogy of that pot plant, that's one of the ways that you get rid of damp. But we think about it more in terms of herbs, like ganjiang would be the sun drying the damp. And there are other Chinese herbs which a herbalist can prescribe to you. They're I'm not going to mention them here because they're things that you need to be prescribed. They're not things you can get over the counter. But there are yang tonic herbs that can dry the damp. And that they are, when something's a yang tonic, it is the sun. The yang is the sun. So it's like a little sun inside you, drying up the damp, right? That's what that is. All right, cool. All right, we're going to leave it at that. And hopefully probably about Thursday, I will think that this episode will come out with Michael, this interview. It'll be really good. And and then I've got a couple of other ones coming that I need to edit. And happy days. All right, thanks everyone. Have a great rest of the day or the night, and we'll see you again on another video soon.